It is our KSAT Q&A where we separate the fact from the fiction, and a big topic since we've started this segment has been COVID-19. And it appears as if we're right back there again with rising cases. Dr. Ruth Berggren with the Long School of Medicine at UT Health San Antonio, an infectious disease doctor. Thank you for joining us as you have so many times, Dr. Berggren. Let's talk about where we are right now. We're seeing a surge in cases. Is this deja vu all over again for you?
Yes, I wish I had better news for everybody, Steve and Myra, but our own hospital has seen a 66% increase in cases. That's true across San Antonio. That's just in the last week. And for some reason, we're outpacing Texas. So if we look at the online information that's available through the Institute for Health Metrics and Evaluation, it shows Texas overall had a 23% rise in hospitalizations, and we here in San Antonio have had a 66% rise. And this is almost all in the unvaccinated population, Steve.
So most people who, overwhelmingly, the majority of people who are in the hospital right now, they have not gotten the vaccine.
That's exactly right.
Okay, so let's talk about for people who are vaccinated, the CDC coming out this week and saying if you are indoors, continue to wear a mask, even if you have been fully vaccinated. Bexar County Metro, or San Antonio Metro Health, saying the same thing. So, of course, there was a response from some people saying, then what was the point of the vaccine if we have to wear a mask? So explain to us, because of the Delta variant, why there is a need for the mask if you have been fully vaccinated.
So first, let me say that the point of getting vaccinated was to prevent you from dying. And the vaccine will still prevent you from dying. And the point of the vaccine was to prevent you from getting severely ill to the point where you needed hospitalization or could have long-haul COVID. And largely, the vaccine is still doing that. So there was always a really good point of getting vaccinated. Now, if your question is about masking, and the changes in the recommendation, this is happening because the data are piling up that vaccinated people can get infected with Delta, they can get mildly ill with Delta, and when they are infected and either asymptomatic or mildly ill, they can easily transmit to other people. And in fact, we're seeing that in our own faculty and staff on the campus at UT Health.
And to further your point, Dr. Berggren, I mean, it's like the flu shot. The flu does not prevent, the flu shot doesn't prevent you from getting the flu. It prevents you from getting terribly sick from the flu in a lot of instances.
And it probably prevents a lot of clinical cases of flu, but we know that there's breakthrough cases with the flu, and if there's breakthrough cases, they're generally mild. And so that is the point of being vaccinated, is you don't want to be one of those people that winds up in the hospital.
It's still,
go ahead.
There's still a lot of questions and misinformation that is out there. And it seems like we are having our own surge in questions that we're getting from our viewers about the whole thing. And one of the questions that we got in recent days is, you look at the CDC map, the hotspot map, and you see Bexar County is considered high in the transmissibility. Then you look at the Metro Health map, and I think we have, this is the CDC map that I was talking about, Bexar County in the red. You look at the Metro Health map, and it shows that we are in the moderate risk and worsening. What are the differences between these two, and when should people be paying attention to all these different maps and graphs that we see out there?
Right. So I can understand the confusion about that, but that Metro Health graph is showing you an aggregate of a bunch of different variables, and it includes things like our capacity for testing, which is still really good, and it includes things like the hospital stress score, which is not off the meter. Okay, so if you consider that we're moderate, we're doing really well with testing, and our hospital stress score at this moment is not terrible, even though our transmissibility risk is very, very high. And those things are bright red in other places. If you look at the dashboard, the aggregate of all those things comes out to moderate risk level overall to the community. But we are for sure, even on the Metro Health website, showing very bright red, critical, high risk for transmission in our community.
We have heard about a handful of variants at this point. Obviously, Delta is the one that is having the biggest effect on our community and the country right now. But we've heard of other variants since Delta. So what is keeping this virus from continuing to mutate and come up with new versions of itself?
Right. As long as the virus is permitted to replicate, to be transmitted from person to person, it will do what viruses do, which is that they're going to mutate in ways that give themselves advantages for survival and increases in infectiousness. The way to stop the virus from mutating is to stop people from getting infected. And we have two ways to stop that. One, get vaccinated. That's the most powerful. And the second is wear the mask.
I'm going to give you 30 seconds to give just your message to the community tonight, Dr. Berggren.
Well, San Antonio, we want to have a flourishing and healthy community. We know how to get there. I'm going to keep this real simple. If you haven't gotten vaccinated yet, go and get vaccinated now. The hospitals are going to be stressed. We're not stressed at this moment, but we are heading in that direction based on all the numbers. What we want is a healthy, happy, flourishing San Antonio where people can do their business, go to school, and have good lives. If we want that to be the case, we need to do two things. We need to get vaccinated, all of us, and we need to be willing to wear the mask, even those of us who have already been vaccinated.
Dr. Ruth Berggren with UT Health San Antonio, as always, thanks for your advice and your answers.
Happy to be with you.
Thank you, doctor. We'll be right back.